Hi everybody, it's Dr. Cary. I'm a chiropractor here in Kelowna, British Columbia, and today we're talking about posture. How can you correct your posture, why it's important to have good posture, and what you can do to help yourself. I'm a chiropractor here in Kelowna. I've been practicing for over 25 years, and I've seen thousands of patients for poor posture. I wrote a book about it, initially called Back Pain. It's on Amazon. And then after that, I followed up with a book on neck pain. So you can get that on Amazon as well in paperback, ebook, and audiobook. So today we're talking about posture, and I wanted to go over what good posture is and what bad posture is, and then how you can help yourself. So just bear with me while I switch this slide here. And so what is good posture? Good posture is alignment of the body right to left, and it should be straight down the middle. So if we're looking at someone's posture from the front or from the back, we should see it aligned or balanced, and then the spine straight down the middle. Now, sometimes what we see in the clinic is curvatures of the spine, scoliosis, where the spine is out of alignment, or the shoulders are unlevel, or the hips are unlevel, the leg lengths or arm lengths. So these are all indicators that there's a problem with the alignment right to left. The other thing that we look for is alignment of the body front to back. So if the body's not aligned front to back, then that can cause problems too. And what I mean by front to back is we want to see the proper curvatures in the spine. We want to see a forward curvature in the neck called the lordosis. We want to see a backward curvature in the middle part of the spine called the thoracic kyphosis. A forward curve in the lumbar, and a backward curve in the sacral area. So these curves balance each other out. And it's interesting if you add up the degrees of the curvatures, how well balanced the body is. That just keeps us upright, but allows us flexibility because we need to be able to bend and twist and lift and do all the things we want to do. But it also allows the nerve flow to continue to get through. And so the nerve flow is going from the brain to all the parts of the body through the spinal cord. So if we have misalignments in the spine, it can cause problems with the nerve flow, the muscle function, and just the way you feel in that area. So what is bad posture? And I'm reading from the slides here in our webinar on our website. So if you're on social media, just follow along, or if you're listening to our podcast, just follow along with me. So what is bad posture? It's when you're slouching, you're sitting at your desk, your monitor may not be positioned properly, it's too low. Maybe your monitor's off to the side, like in this picture right here, and you have poor ergonomics. And a lot of my patients, when we discuss this, they don't have their desk set up properly at home or at work, and it's causing them to have strain on a repetitive basis in certain areas. The body will adapt to that, and over time, that will start to cause imbalances in the body. So we don't want someone looking to the right all the time at their monitor. Or slouching because they don't have the best chair posture. So we really want to make sure that we review the ergonomics at a person's workstation, even things like driving. We have a lot of truck drivers in the clinic, people that are sitting a lot, making sure that their seat position is good in the car or in the truck, and their arms are at the right height and the right level. There's a slight bend in the elbows and a slight bend in the knees for the foot pedals. So we want to make sure that the person has the right ergonomics so that they don't have bad posture. Sometimes people have poor posture because they don't feel well. They have pain or discomfort. Maybe they have some anxiety or depression, and that reflects in their posture too. So there's a number of factors that affect posture. Sometimes people develop curvatures in their teenage years and they have scoliosis, and that's affecting their posture, or poor footwear. So there's a number of indicators and contributors to poor posture. And as a chiropractor, we want to review with the patient their history, how long they've had poor posture, what their background's like, their family background, their own background, if there's been injuries that have caused misalignments in a certain area and they've adapted to those injuries, like a car accident. We want to go over that, and then we want to see what we can do to improve on that condition. So what can you do? I recommend that you see a chiropractor. If you're in Kelowna, you can come and see me. We are accepting new patients. But if you're not in the Kelowna area, please reach out via PM, or you can message me. I do my best to find you a chiropractor in your area that can help you. So number one, get assessed properly by a chiropractor so they can determine if you have good posture or not. And one of the things I like to do on my initial assessment in the clinic is take some postural pictures. I take these postural pictures from 4 angles: the back, the front, the right, and left. And then as we do treatments and we do our progress examination, I like to compare the new postural pictures to the old ones and see how much the patient's changed. Often I'll point out or show the patient how much improvement that we're seeing in the clinic to their posture. And then over time, what I'll do is have that in my records so that if the patient is a long-term patient, after a year or two, and they're coming for maintenance, we can always look back. And it's always fun to look back a few years and say, hey, here's how you came into the clinic. Look at you now. Look how much better your posture is. Look how much better your health is. And look at the things you're doing now compared to when you first came in. So chiropractic can make a profound difference. And what the patient does to help themselves can really make a big difference as well. We want to give our patients exercises to improve their posture. One of my favorites is called wall angels, where the patient stands against a wall with their head and their back against the wall. Their arms are out at a 90-degree angle, and they're doing these wall angels. They're like snow angels, but against the wall. That's very good for posture. I also like to give some strengthening exercises like planks or side planks, the bridge, which is like a yoga posture. These positions really help to improve the posture as well. Of course, we're going to do spinal adjustments in the clinic. So we're going to adjust the areas out of place to realign those areas as best as possible. And then we're going to give the patient these exercises to support that. So we have to work as a team between the sessions in the clinic and what the patient's doing at home. I find the patients that are most diligent about their exercises do the best. So if they're at home doing the exercise on a regular basis, it's going to help with the care in the clinic. It's going to speed things along. They're going to get better results. We do want to talk about the desk and the position of your posture in the car, depending on how long you sit at the desk for and how long you're sitting in the car or truck. One of the things I like to recommend to my patients is getting one of the desks that go up, like a standing desk or a sitting desk, and changing positions frequently, because that helps to take the pressure off certain areas. And there's a lot of research coming out saying if we sit too long, it's just equivalent to something like smoking, where it's really bad for our health. So I would say sitting is the new smoking as far as what we want to address for issues for health long term. Your posture in bed, the way you sleep, is important. So sleeping on your back or your side is the best position. And depending on your alignment, we may recommend that you sleep on one side versus the other as we go through care to correct the alignment and the posture. And of course, we want to strengthen the body to keep everything in place so long term you get good results. And we don't have to do the same thing over and over again. We don't want to spin our wheels where it's like one step forward, one step back. We want to go 2 steps forward, 1 step back. If you're interested, you can find my book on Amazon. It's called Back Pain, and then there's one called Neck Pain as well. I do talk about posture in the book. There's the 3 formats. There's the ebook, there's the paperback, and the audiobook. A lot of people like the audiobook and they listen to it. A lot of my patients have told me that they've got the audiobook and they're listening to that, so that's great. We are accepting new patients at the clinic. Usually we can get a new patient in within 48 hours. We are in 7 days a week, and we work until 7 on Tuesdays and Thursdays. So lots of flexibility for appointments, as well as we accept benefits. So if you have third-party benefits, we do bill directly, as well as to car insurance. So if you have ICBC and you were in a car accident, we bill directly to car insurance. And we've done that with other provinces too. We have a lot of patients that have come to see us and they're from Alberta or have Alberta car insurance, and we've billed directly to their insurer. The last thing I want to tell you about is I have coffee with Dr. Cary, and that's going to be on Sunday morning. And I like doing this coffee segment when I can, and most weeks I can. Sometimes I'm out of town. But if you want to join me for coffee with Dr. Cary, go to our website, and then you can get a ticket there. And I'm going to show you in a sec how to do that. But this is a chance for me to interact with you. If you have questions, you can type them in the chat. You can always send me the questions in advance and I can answer those. We do record these segments and we put them up on YouTube. If you haven't already, subscribe to our YouTube channel because you'll get an automatic notification when we have new events that get posted. Same with our podcast. Subscribe on Spotify or Audible or on iTunes to that. So feel free to follow us there on those channels. I'm just going to switch over here to our website. So just bear with me while I switch screens here. And here is our website. I'm just going to walk you through how to get a ticket for the Coffee with Dr. Cary or for the upcoming event. So when you type in Dr. Cary Your Cue, you're going to get this as the homepage. It tells you a little bit more about me and my background, why I became a chiropractor. If you click on the 3 dashes right here, you can go down to the events. And when you click on the events, what you're going to see is this screen right here where we have the upcoming events. And today we're going over posture. And then on Sunday, we have the Coffee with Dr. Cary. We try to do that each Sunday. And then on the 26th, which is Tuesday, we're talking about shoulder pain. So we'll be covering things like rotator cuff, shoulder injuries, glenohumeral, AC joint. We'll be talking about the head, neck, and shoulder, how they're connected. So it'll be a really good webinar just covering shoulder issues and what we see in the clinic. I'll be talking about chiropractic, but I'll be talking about shockwave and laser as well. And then on the 3rd of May, the following Tuesday, I'm going to do a webinar on foot pain. And that'll include the foot and the ankle, sprains and strains. We'll talk about plantar fasciitis, which is a condition of the bottom of the foot. We'll be talking about heel spurs and bunions and proper footwear. So all of those things on the 3rd. All of these webinars are free of charge. Sometimes we do have master classes. Those are paid events. And the reason we do those is when we have a popular topic, patients want to know more. Let's say they want to know more about exercises or specific things they can do. We'll do a longer webinar that's more detailed and more interactive, and that'll be a paid event, and that'll be in this section as well. The other thing I wanted to show you is our blog, so feel free to follow our blog here on our website. You can get updates as to when the newest webinars are posted, recordings of the past webinars. So it'll just keep you up to date on what we're doing in the clinic. And then the last thing is the appointment section. If you're interested in booking an appointment, you just click on this. Very simple steps here, it just outlines the steps for you. And then go ahead and click book now right on that button. And then when you click on the book now button, it's going to give you an opportunity to choose a day and time, and then your first and last name, email address, and phone number. And once you click book, you don't have to pay at the time of booking, but after the service when you come in the clinic. And then you'll get a notification that the appointment's booked, and then we'll send you the paperwork to e-sign in advance. So it's really simple and a very easy process to come and see us. And so I want to thank you guys for joining me today. I appreciate you being here for this postural webinar. Thanks for joining me on social media as well. Please follow our channels here on social media, Instagram, Facebook, Twitter, and TikTok. And we'll talk to you guys soon.